Colon cancer is a formidable adversary that often goes unnoticed within our bodies until it's too late. This disease, marked by the uncontrolled growth of malignant cells in the colon or rectum, can affect anyone, regardless of age, gender, or race. In today's video, we're breaking down the top 10 most critical symptoms of colon cancer, including crucial distress signals from our body that demand immediate attention and action. With colon cancer being the third most commonly diagnosed cancer in both men and women in the United States, and a significant cause of cancer-related deaths globally, the importance of early detection cannot be overstated. Fortunately, there's hope, because recognizing symptoms early can drastically improve colon cancer prognosis and treatment outcomes. So keep watching to learn more about the most critical colon cancer symptoms. Number 1 on our list is blood and stool. Discovering blood in your stool can be an alarming symptom, often indicative of various gastrointestinal issues, including colon cancer. The presence of blood can manifest in several forms. It may appear as bright red, signifying bleeding from the lower part of the digestive tract, or as dark red or black, suggesting a source higher up, which allows the blood time to darken as it moves through the intestines. While there are benign causes for blood in the stool, such as hemorrhoids or anal fissures, it is a hallmark symptom of more serious conditions like colon cancer. In colon cancer, tumors in the colon or rectum can bleed as they grow, shedding blood into the stool. This symptom should never be ignored, as early detection of colon cancer can significantly improve treatment outcomes. Individuals noticing blood in their stool should seek medical evaluation promptly to determine the underlying cause and initiate appropriate management. Number 2, abdominal pain or discomfort. Abdominal pain or discomfort is a common symptom that can be associated with a wide range of conditions, including colon cancer. This type of discomfort can vary greatly in its nature and intensity, ranging from a mild, intermittent ache to severe, persistent pain. In the context of colon cancer, the pain may arise from the tumor itself as it grows and exerts pressure on the surrounding tissues and organs, or from a blockage that the tumor causes in the colon. This can lead to cramping and discomfort as the body attempts to move waste through the obstructed area. Additionally, gas and bloating may contribute to the sensation of discomfort due to disturbances in the digestive process. It's important to note that while abdominal pain is a common symptom, it is not specific to colon cancer and can be caused by many other conditions, such as infections, inflammatory bowel disease, or irritable bowel syndrome. Nonetheless, persistent or unexplained abdominal pain should always be evaluated by a healthcare professional to rule out serious conditions like colon cancer and to ensure timely and appropriate treatment. Number 3, unexplained weight loss. Unexplained weight loss, often defined as losing 5% or more of your body weight without trying, can be a concerning symptom and a potential sign of colon cancer. This type of weight loss occurs when cancer cells disrupt the body's ability to absorb nutrients properly, and when a large tumor in the colon makes it difficult for nutrients to be absorbed. In addition, cancerous cells require a significant amount of the body's energy. As they grow and multiply, they can increase the body's metabolism, leading to weight loss. This symptom is not specific to colon cancer and can be associated with a variety of other health conditions, including other types of cancer, thyroid problems, and digestive diseases. However, when combined with other symptoms such as changes in bowel habits, abdominal pain, or blood in the stool, unexplained weight loss can be a significant indicator of colon cancer. Number 4, anemia. Anemia associated with colon cancer is often a result of chronic blood loss that goes unnoticed for a long time. Unlike acute bleeding, which can manifest quickly through visible blood clots, the bleeding caused by colon cancer tends to be slow, leading to a gradual decrease in the number of red blood cells and the amount of hemoglobin, the protein in red blood cells that carries oxygen. This process can take months or even years, making it insidious and easy to overlook. Symptoms of anemia include persistent fatigue, paleness, shortness of breath, and a general feeling of weakness. These symptoms arise because the body's tissues and organs are not receiving the oxygen they need to function properly. In the context of colon cancer, anemia is a critical sign because it often prompts further investigation that can lead to the diagnosis of the disease. Detecting anemia early and understanding its potential link to colon cancer is essential for timely diagnosis and treatment. Number 5. Fatigue. Fatigue related to colon cancer is a profound type of tiredness that doesn't improve with rest. It's not just a feeling of being sleepy or tired, it's a pervasive sense of exhaustion that can affect every aspect of a person's life. This fatigue is due to a combination of factors. First, cancer cells compete with normal cells for nutrients, which can lead to a general state of malnutrition and weakness. If the cancer causes chronic blood loss, it can lead to anemia, which we've discussed previously, exacerbating feelings of fatigue due to decreased oxygen transport to tissues. Furthermore, the body's immune response to cancer can lead to inflammation, which is energy-consuming and contribute to the feeling of being worn out. Lastly, the psychological impact of dealing with a chronic illness can also play a significant role in the development of fatigue. Patients may experience a decrease in physical activity levels, further contributing to muscle weakness and a decline in physical condition, making this symptom a vicious cycle that's hard to break. Number 6. Constipation. Constipation is a common digestive condition characterized by infrequent bowel movements or difficulty passing stools. When associated with colon cancer, constipation can result from a tumor obstructing the colon, making it difficult for waste to pass through. This obstruction can lead to a buildup of stool, causing discomfort and infrequent bowel movements. The consistency of the stool may also change, becoming harder and more difficult to pass, which can exacerbate the discomfort and effort needed during bowel movements. It's important to understand that while constipation is a common issue that can arise from a variety of causes such as diet, lifestyle, and medications, persistent constipation that does not respond to usual treatments warrants medical attention. Individuals experiencing persistent constipation, especially with these additional symptoms, should seek a medical evaluation to rule out colon cancer or other serious underlying conditions. Number 7. Diarrhea. Diarrhea, defined as loose, watery stools occurring more frequently than usual, can be a symptom of colon cancer when the disease affects the colon's ability to absorb water from the waste material passing through it. This inability can result from a tumor obstructing the colon, leading to an alteration in the fluid absorption process, or from the cancer directly affecting the cells lining the intestine, disrupting their normal function. Unlike occasional diarrhea that can result from dietary changes or temporary infections, diarrhea associated with colon cancer is persistent and may not resolve with over-the-counter treatments. It can lead to dehydration and electrolyte imbalances, further complicating the individual's health status. Diarrhea that occurs alongside other symptoms such as abdominal pain, blood in the stool, unexplained weight loss, or changes in the caliber of stool should raise concerns and prompt medical evaluation. Number 8. Changes in bowel habits. Changes in bowel habits that persist for more than a few days can signal colon cancer. This symptom encompasses a range of alterations in the frequency, consistency, shape, or color of stools. Individuals may notice an increase in constipation or diarrhea, a feeling of incomplete evacuation after a bowel movement, or a change in the size or shape of the stool, such as narrower stools than usual. These changes can occur if a tumor in the colon or rectum alters the organ's function, affecting how waste moves through and is processed by the digestive tract. It's important to recognize that changes in bowel habits may result from dietary adjustments, stress, and various benign conditions. However, continuous changes, particularly if accompanied by additional symptoms, should not be overlooked. Number 9. Rectal bleeding. Rectal bleeding is a symptom that may manifest as bright red color on the toilet paper, in the toilet bowl, or mixed with the stool. It is a potentially alarming sign that can indicate various conditions, from benign issues like hemorrhoids or anal fissures, to more serious concerns such as colon cancer. In the context of colon cancer, rectal bleeding occurs when the tumor in the colon or rectum bleeds, either as a result of the tumor's growth into nearby blood vessels or due to the irritation of the tumor's surface. This symptom is particularly significant because it is often one of the more visible signs of colon cancer, prompting individuals to seek medical attention. However, it's important to note that rectal bleeding is not exclusive to cancer and can be caused by other conditions, which are often less serious. Regardless, any instance of rectal bleeding should be evaluated by a healthcare professional to determine its cause. Number 10. Narrow stools. Narrow stools, often considered a subtle sign, can indicate a change in bowel habits potentially linked to colon cancer. This symptom arises when a tumor within the colon starts to obstruct the path through which stool passes, causing it to take on a thinner appearance than normal. While occasional variations in stool size and shape are common and usually not a cause for concern, persistent narrow stools warrant medical attention. It's essential to understand that the diameter of stools can be influenced by a variety of factors, including dietary changes and hydration levels. However, when accompanied by other symptoms such as abdominal pain, blood in the stool, or unexplained weight loss, narrow stools can be a more concerning indicator. Healthcare professionals often use a combination of diagnostic tools, including colonoscopies and imaging tests, to investigate the cause of narrow stools. But as you can see, recognizing the symptoms of colon cancer is a critical step towards early diagnosis and effective treatment. While the presence of symptoms like rectal bleeding, narrow stools, and persistent abdominal discomfort can be concerning, they serve as crucial indicators that warrant medical evaluation. Early detection of colon cancer can vastly improve the prognosis, highlighting the importance of paying attention to your body and seeking medical advice when changes occur. By being aware of these symptoms, you can take proactive steps to managing your health and potentially safeguard against the ramifications of a late-stage colon cancer diagnosis. But real quick, be sure to watch some of our other helpful videos that are popping up on your screen right about now. And just a quick reminder, we are not doctors. This video is for informational purposes only. Have a nice day, and thanks for watching.